Good afternoon, distinguished ladies and gentlemen. Good afternoon, the chairman of this occasion, and the governing council chairman here represented by the former provost of the College of Medical Sciences, Professor Victor Ansa. I also recognize the provost of the College of Medical Sciences, Professor Ngim E. Ngim, who is behind this ceremony holding today. Welcome, sir. I also recognize the keynote speaker who has given us a very inspiring lecture. I'm here to present a very brief citation of the first plenary lecturer, and she's also my mentor, so I'll ask her to please stand while I say a very little thing about her. She doesn't like publicity, but this has to be done. Welcome, ma'am. Professor Asuquo is a very proud alumnus of this university, the University of Calabar. She's a proud pioneer graduate of the microbiology program in the then Department of Biological Sciences, and she graduated in 1983. She started her career in academia in the then University of Cross River State, Uyo, as a graduate assistant in November 1985. She obtained her MSc in microbiology in 1989 from the University of Ife, now Obafemi Awolowo University, and a PhD in infection in 1993 from the University of Birmingham, England, utilizing the Association of Commonwealth University Scholarship, which she won in 1990. In 1995, as Lecturer 1, Professor Asuquo transferred her services from Uyo to the University of Calabar, Department of Medical Microbiology and Parasitology. She was immediately appointed the examination officer, a position she held for 3 years, and was the first to introduce computerized student results in Unical, and that's what we are still using today. She has at various times served in several capacities, including Departmental Graduate Committee Chair, Unit Coordinator for Medical Microbiology and Parasitology Unit, Head of Department of Medical Laboratory Science, Sub-Dean, Dean of Faculty of Allied Medical Sciences, Deputy Provost of College of Medical Sciences, Chair of Research and Linkages Committee of the Graduate School, Member, Institutional Biosafety Committee, and she is a permanent member of the Senate of the University of Calabar and past council member of this university. Apart from being actively involved in teaching, both at undergraduate and postgraduate levels, Professor Asuquo has supervised over 30 PhDs and MSc students, as well as several undergraduate researches and PGD projects, and has mentored many young academics, including yours truly. Her research interest is on antimicrobial susceptibility studies and tuberculosis, among other infectious diseases. She has published widely in peer-reviewed journals with high web visibility. She was the 66th inaugural lecturer of this university and the 20th induction lecturer of the Department of Medical Laboratory Science. Professor Asuquo is widely traveled, locally and internationally, where she has disseminated her research findings and updated her professional and leadership skills. She's a member of several professional bodies, including the American Society of Microbiology. She has received several formal trainings in various aspects of university governance and is actively involved in NUC accreditation and resource verification processes. She is an assessor of associate professor and professorship positions to many universities. In her pursuit, she has been beyond the walls of academic environment. In 2001, she received a UNESCO short-term scholarship on biotechnology, with which she spent 3 months as guest researcher in the CDC, the Center for Disease Prevention and Control in Atlanta, Georgia, and in the Georgia Public Health Laboratories. She served as health advisor to Mobile Producing Nigeria Unlimited between 2005 and 2006 on sabbatical appointment. She also facilitated the first ever program for active case finding of tuberculosis in Nigeria. In 2007, she utilized a scholarship provided by NNPC Mobile Producing Nigeria to attend the American Society for Microbiology conference in Toronto, where she was able to present the findings of that work. Between January and December 2016, she held sabbatical position in Shell, and she was the research advisor. She has also contributed to the guidelines, the national guidelines on sexually transmitted infections, and she's an invited speaker at many conferences. As Dean of Faculty of Allied Medical Sciences, she organized the first ever formal mentoring training for the faculty members and the university at large. And she is one of those female academics who has helped to mentor other young females to understand and balance the enormous challenges of combining family and career. While being cordial and motherly, she is quite firm and known for her integrity and uprightness. Mr. Chairman, sir, Professor Asuquo is a committed family woman and very devoted to God. So I hereby present to us the first plenary lecturer who will help expound this topic more. Thank you very much.
I think I need to whip her this afternoon because I told her clearly, don't go making long. I told her, I said, just let me tell the story that is relevant to this. But she has. Okay. So, thank you very much. I appreciate. Please forgive me. I'm not very good at protocols. I respect everybody seated here, and I acknowledge through the chair that time has gone. So let me proceed. Thank you very much. Let me also thank the committee and the provost for mentioning my name for this first plenary one. I am hoping that what I bring to the table will make sense. I was given a free hand to choose a topic. And so my topic says, threats to training globally competitive allied health professionals in Nigeria. By way of presentation, very quickly, I'll look at few definitions. I'll take a very brief introduction. I will tell us who allied health professionals are, and then take a peep at what the CCMAS is saying by way of curriculum. Then go to the juicy part, which says the threats to effective training of allied health professionals. I would attempt to proffer some solutions and then bring a conclusion. I'm hoping that I will be as straight to the point as the keynote speaker has been. He has saved us trouble. So, definitions. I just want to take the word threats. Of course, we know what threats are, but this is a person or anything that is likely to cause damage or danger. So when we talk about threats to training, So, and what is training? It is something all of us are doing, undertaking that action of teaching somebody a particular skill or a type of behavior. Of course, globally competitive. Global is worldwide. Every part of the world is involved, and competitive, whatever. You know, when two people are doing something and they are competing for a particular thing. We live in today's world. Whatever you are doing, in fact, whatever anybody else is doing, you can see it on your palm because the phone is right beside you. Very quickly, introduction. Universities contribute hugely to the nation's economy. We know that it is who we churn out of the citadels of learning that go out there to practice or not practice or whatever, but they bring something back by way of adding to the economy. In so doing, we impart skills and develop creativity in the minds of people who need to go out there and do that. That's what we do. We cause them to develop their creativity and become analytical thinkers. We create and disseminate knowledge through teaching, learning, and research. I want to say that without physical facilities, we cannot do any of this. So physical facilities are the operational ingredients for teaching and learning. The current NUC CCMAS, that is the curriculum, the core curriculum minimum academic standard, projects certain things about health, allied health graduates. What do they want to see? What should be the outcome of this category of health workers? It wants us to develop, in addition to them being able to understand the concepts, understand the theories of the subject area, that they should be analytical, they should be vested with knowledge to be able to maybe craft a research topic, analyze it, decide what tools you want to use, epidemiological tools or whatever, to analyze this, interpret your results, evaluate those results. And this is all in the area of health research. They should also be able to master the use of technology to make administrative and clinical decisions, thereby being able to improve their performance. Now the question is, or the challenge is, are Nigerian universities equipped to deliver on this and many more demands that the CCMAS is making? Who are we talking about? Who are the allied health professionals? It was interesting as I looked through to understand that the nursing science or nurses are not actually supposed to be under allied. They are not allied health professionals by the definition, global definition. That they are themselves nurses, doctors, dentists are medical and not allied professionals. I just found that. But that is not the issue. Here is who is giving us the definition. And so I went to my CCMAS, and the CCMAS put them as members of Faculty of Allied Health Sciences. So these people, what are they supposed to be doing? You have those who are diagnostic, and we have medical laboratory science, and we have radiographers. We have preventive, the public health, they prevent disease. We have the therapeutic. What I have done is just choose the departments or the programs that we run. So we have nutrition, human nutrition and dietetics. For medical care, I decided to put them as medical care, and nursing science belongs there. And then we have the rehabilitative, which is physiotherapy. But the global definition for allied health professionals has 4 areas: diagnostics, preventive, therapeutic, and rehabilitative. And each of these has their own slogan. You know, for medical laboratory science, we are the bedrock of modern medicine. Radiography, the eye of medicine. Public health gave me some things which I didn't take, so I decided to put this, that they are preventing this disease. They are actually there before the doctor. The human nutrition and dietetics, they didn't give me anything, so I assume that they are just, you know, making sure whoever is healthy. Okay? So nurses are the heart of medicine. Can I hear a good thing from them? They are the heart of medicine. Thank you very much. So, and the rehabilitative, I got to talk with a physiotherapist who told me they are the bridge, they are the restorer, they are the architect, they are the navigator of medicine. There were so many, many, many. But I just decided to choose these 4. So, this is the list of programs for CCMAS, and the ones that I have asterisked are the ones that we are offering: BMLS, BNSC, BSc, Human Nutrition, Physiotherapy. Pharmacology, incidentally, is supposed to be here. Then Public Health and Radiography. Those are all listed by the CCMAS, so we are in the right direction. So, to make my work easy, sincerely, when I looked at the training needs of these health professionals, I decided to go to the CCMAS. What is the expectation of CCMAS for, or what are we, so what is supposed to guide us? So I looked at the broad philosophy of allied health sciences, and this is supposed to guide the training. So you have to produce professionals. What I did was that where you have the red are my words of emphasis. I just decided to emphasize that. If you go to the CCMAS, these things are a lot more wordy, so I have just pruned them to make sure I don't also lose the meaning. So, to produce professionals with sound academic and professional backgrounds for national and global markets. You will agree with me that as they are coming, they are being taken. Okay? So, now I hear that we are told that we should double admission, so that, but I will come to that, because doubling admission without doubling the money does not make sense. So, they should meet global standards and have knowledge base to undertake further training towards specialization. They should possess sufficient management ability to be able to lead, to play leadership roles in the health sector, and they should be empowered with skills that will enable them to engage in entrepreneurship and income. So these 4 things are supposed to guide whatever we are putting down to train these students. And what are the objectives? All this, like I said, come from the CCMAS. Provide students with a broad, balanced foundational knowledge and practical skills. I have highlighted that in these areas of clinical diagnostics and the rest of them. Then produce graduates who can function independently or in collaboration with other members of the health team. At this point, I had told myself that I would do a small role play, but that came very late to me. I wanted to simulate a medical condition where somebody comes to the hospital and sees the doctor. And after that, the doctor takes a systematic approach and says, okay, I'm going to do this investigation. And in the meantime, while the investigation is on, I will admit this person. And as we admit that, when the investigations are done, laboratory investigations or radiology done and brought back, and then this is what we want to do next. What's the next step? Who is coming? So by the time you have finished with everything, oh, somebody has a stroke and you need the physiotherapist. So at the end of the day, you have a team and every single individual is playing an important role. Without that, the sector cannot function. I'm sure that's you agree with me. So it's important that everybody shines their shine, has knowledge in their area, and does what they ought to do for the sake of the patient. By the way, who is the patient? All of us can be patient at any given time. That's the truth. So when we are training, what are we doing? Make sure you don't train people that you will be afraid of meeting tomorrow. So we engage the students also in an intellectual, stimulating, and satisfying experience of learning, studying, research, inculcate in students a sense of enthusiasm for the program, develop in students the ability to apply knowledge and skills to be able to solve theoretical and practical problems. At this point, let me just tell a little story about me. As my citation reader said, I graduated from here. To start with, I think I said this at my inaugural lecture. I was very, very, how do I put it? I desperately wanted to be a lawyer. My second choice was to be a journalist. At the point of filling my JAMB form, in fact, I went and bought my JAMB form and came as I was filling. My father had brought a visitor to the house. And when I came, oh, young lady, where were you? I said, I went to buy my JAMB form. Oh, what do you want? All along, my father had not asked me what I want to do. All right, okay, I think I had mentioned that I wanted to be a lawyer. So I went. He didn't discourage me. So a lot, you go to our taps, there's no water. So who are we training? What do we want them? So somebody, I sit and laugh when we have oral exams. And my colleagues will say, because of the answers that the students will produce, they will say, if I see you in a place, I'll run away, I won't come to you. I laugh. Run how? What did you give them to work with that you expect them to know to the extent that they need to know? That's the issue. So we need to get a lot in place. I want to just read this. This is taken from a report of universities, of assessment of universities. Some universities, about 21 of them across the nation. And this was written by about a particular university. It's not ours. Please take note, because I think we are doing better than this. In terms of learning resources, this university is in acute lack of almost every resource required for teaching and learning. This university is old, and as a result has more than its due share of aged, outdated, and dilapidated equipment to enable the university function. Several departments have final year students in programs requiring practicals and experiments, but have no access to any of the equipment required. This is a first generation Nigerian university. It is still functioning. But this comment is not so far away. I think maybe either 2018 or something. So I said shortage of qualified faculty. The keynote speaker also mentioned that. The first day the provost came to visit our faculty, I mentioned something. I said, sir, we do not have young ones in this faculty to mentor, because there's no employment anymore. So the least person you see is now lecturer 1 or something like that. So when accreditation comes, they expect that you should have 45% of people in this category. Where are you getting them from? So these are real situations that we want to look into. It's real. So we have talked about Japa syndrome, and then the retention of staff, which is very low. I think before now, universities thought that they had the best, okay? They could do anything. But at the end of the day, they have come to realize that people can leave. Do you understand? People can leave. They have a choice. So lack of interest in academia, and the question is, who are we handing over to? Brain drain, you have the pull factors that are taking people out there, and you have the push factors that we have here that is pushing people to the incentives outside. Interprofessional conflicts, we better resolve ourselves, and then poor environmental. The last thing I said here, which has not reflected, is integrity of our grades. And I want to just say something. I was very, very happy. On the 28th of September, we had good news from one of our students, a 2022 valedictorian of our faculty. And she said she was overwhelmed. Her name is Olivia Kamsi Moka. She received in fact, she got admission into Cambridge and Oxford, and she was asked to choose one. And she had 3 full scholarships, fully funded scholarships to these 2 places. And when we were sharing experience, what I said was, the only thing that is exciting me about this, not that I'm not excited about the whole program, but that our best can become a global best. That's what it is. She was the valedictorian, and today she has proven that. So I thanked my people for the integrity of their grades, because that's what it is. If you don't deserve it, you don't get it. But if you deserve it, encourage them to get it. In conclusion, let me just conclude. I won't talk about am I going back? Okay, possible solutions. I think we can get those. There's not much. Collaborations with alumni endowments, and then please, when you get money from funders, use the money well, apply it appropriately for what it is. I will skip those and then come to this self-evaluation and conclusion. Vision and mission of the University of Calabar. What does it say? To produce high-quality graduates and scholars in focal areas of learning with theoretical, practical, and entrepreneurial skills for the world of work in conducive environments through quality research and teaching. We will evaluate ourselves whether what we have used our hand to write is happening. May God help us. And in conclusion, I asked, who is responsible for this monumental failure? What can we do about this? Who will bail the cat? So please help me watch the video as we close.
Next story is, who will bail the cat? There lived thousands of mice in a mansion who would keep jumping up and down. One day, the owner of the mansion brought a cat. Now, the rats were in a great difficulty. The cat would quietly sit in the dark, and as soon as she would see a rat, she would pounce on it and eat them up. The poor rats were helpless. One day, they decided to call upon a meeting in which every big and small rats were present. The head of the rats said,
"Friends, you all know that we are in a great trouble. We have all gathered here because the cat who has come to the mansion has put us in trouble. We must try and get rid of the cat.
We shall all go in search of food before it gets dark."
But what difference will it make? Even the cat would start coming before it gets dark.
I have an idea. What if we hang a bell around the cat's neck? We will come to know when the cat is around, and so we can hide inside our holes.
"Wow, that's great. What a nice suggestion."
Wow, this little one has solved all our problems. What an idea. Bell in the cat's neck? How nice. Now there's nothing to worry about.
I will arrange the thread and I'll get the bell.
It's a nice idea, but there's one problem. Who would bell the cat?
Everyone was quiet. There was a pin drop silence. Everybody was stunned as they didn't have any answer. Suddenly, they heard the cat mewing. Meow. Listening to the cat's mew, they all ran towards their holes. So children, what do we learn from the story? That it's no use planning unless and until we put things into practice.